Have you ever considered the incredible complexity of your brain, a control center constantly at work, processing thoughts, feelings, and movements? What happens when something goes wrong with its delicate plumbing, specifically a blood vessel? It is a serious event that can have profound impacts on your health and well-being. When a blood vessel bursts in the brain, it is called a hemorrhagic stroke. This means that blood leaks out of the vessel and into the surrounding brain tissue. Unlike an ischemic stroke where blood flow is blocked, a hemorrhagic stroke involves bleeding directly into or around the brain. This sudden bleeding can damage brain cells, interrupt normal brain function, and increase pressure within the skull. The primary reason this is so dangerous is twofold. First, the brain is enclosed in a rigid skull, so any extra volume from bleeding quickly leads to increased intracranial pressure. This pressure can compress brain tissue, reducing vital blood flow and oxygen to other areas. Second, the blood itself is toxic to brain cells when it is outside its vessels, causing direct damage and inflammation. These effects combine to rapidly disrupt the brain's ability to send and receive signals, leading to the symptoms experienced during such an event. Understanding what to do if you or someone you know experiences symptoms of a hemorrhagic stroke is crucial. Immediate medical attention is paramount. The acronym BEFAST helps recognize common stroke signs: balance loss, eyesight changes, facial drooping, arm weakness, speech difficulty, and time to call emergency services. If any of these symptoms appear suddenly, calling 911 immediately is the most important step. Early diagnosis and intervention can significantly impact the outcome, helping medical professionals manage the bleeding and pressure. One type of hemorrhagic stroke is caused by an aneurysm, which is a weakened, bulging spot on a blood vessel that can rupture. Another is caused by an arteriovenous malformation, or a VM, an abnormal tangle of blood vessels that can be present from birth and are prone to bleeding. These specific causes highlight that sometimes stroke can occur due to pre-existing conditions that might not have presented any symptoms before the burst. Modern neuroimaging techniques such as CT scans and MRI scans are essential for accurately diagnosing the type and location of the bleed, guiding the immediate treatment strategy. Ultimately, recognizing the signs of a burst blood vessel in the brain and acting quickly can make a life-saving difference. By knowing the symptoms and understanding why immediate medical care is so vital, you empower yourself and those around you to respond effectively. Prompt action ensures that medical teams can begin critical interventions to control bleeding, reduce pressure, and protect brain function, paving the way for the best possible recovery.